on this episode of The Natural Plastic Surgeon. A lot of men worry about Botox because they don't want to look feminine or things like
Sure.
that. And I think the key is to kind of soften the wrinkles, right?
The whole thing with men and Botox too, I think a lot more people would do it if it was more socially acceptable or
Yeah.
talked about. I think one of the scariest things is for men to admit that they might want it.
In college, I had a procedure done for male gynecomastia. So yeah, so I had like actual kind of glandular breast growth, and that was like really intimidating to me to like just to even just bring up the subject with like my parents. I was like, look, this isn't
Sure,
right.
yeah.
And you are 38 inches.
So that's what, like 3, 4
That's
inches?
3 inches,
Sweet.
over 3 inches
Great.
of improvement.
That's awesome.
High five.
We love that. Yeah.
Hey everyone, this is a natural plastic surgeon, and we have a special guest on the show. We have Travis.
Hi, guys.
And so I'm excited to have Travis on board because Travis is a patient of mine, and he recently underwent a procedure, and he's here today to kind of share it with us. And I think that's kind of special because a lot of people think about plastic surgery and they think of it as,
Yeah.
oh, it's like what women get. You know, they get breast implants or they get, mommy makeover.
Sure.
And but a lot of people don't realize that plastic surgery is perfectly okay and really awesome for men too.
Yeah,
So,
absolutely.
yeah. So Travis, thank you for being on the show. I do want to give you a little quick introduction. Travis is 29 years old. He lives in Venice. He's originally from Lake Tahoe, which I want to kind of dive in here just a minute.
Yeah,
What's
yeah.
it like to grow up in Lake Tahoe?
It's funny. I mean, you grow up in a like destination location.
Yeah.
Like everyone goes to vacation there, but yeah, it's interesting. I ski a lot. Yeah, I miss Tahoe. I love Tahoe.
Yeah. Well, I love Tahoe too, but I didn't know there's anybody that actually grows up there. But I guess there has to be at some point.
Yeah,
right. So you moved to Los Angeles soon after college. You went to UC Davis. You have a 3-month-old dog named June.
I do. Yep.
Hopefully we'll get to see.
Yeah.
Yeah. And then you work in outside sales for a high-end food and beverage company.
Correct.
AKA you always bring cookies to the
Yeah,
office.
I didn't today.
Okay, that's all right. I could have used some today after the marathon yesterday, but and you lead a healthy and active lifestyle, and you enjoy
Yeah.
working out. You play kickball, long walks, jogs on the beach in Venice, and most recently playing with your new pup June.
Yeah, correct.
Okay, so plastic surgery.
Great.
When did this cross your mind that you wanted to do something?
Yeah,
about
no,
that?
that's a really good question. I
Yeah.
mean, I think genetically, I've always been a very active person growing up.
Yeah.
I always played a lot of sports in Tahoe. I skied a ton.
Yeah.
But I think from like a young age, I started. I mean, I don't know how to say it other than like man boobs.
Okay.
I kind of like had like more fat on my chest.
Okay.
Which I was always pretty self-conscious and felt kind of insecure about.
Yeah.
And even when I was in the best shape possible, when I was dieting and all that kind of stuff, it was still there.
Right.
So it's something that I kind of struggled with in high school and in college. And then I thought about plastic surgery when I was like 21 after college, but then I was too intimidated.
Right, because it's like, where do you even start to look for resources?
I
Like
had
you Google
no
plastic
idea.
surgery, and it's
Yeah.
like you probably don't find too many resources for
Yeah,
men.
and like some of the images you see at first are scary.
Yeah. Because what is the internet? What do people want to see? They like the horror stories.
Goriest, gnarliest,
Yeah.
grossest stuff.
Yeah, like Catwoman, whoever that is. I forget. You know what I'm talking about.
Yeah,
just
totally.
way overdone stuff.
But yeah, luckily my family's pretty open about it. I talked to my mom about it, and she's
Mm-hmm.
like, well, if it's something that really bothers you and it's something that you want to do,
Yeah.
we can definitely talk about it.
Right.
So I explored a little bit when I was like 21, and then I continued to like struggle through diet and exercise with certain areas of my body that wouldn't respond. And I think, I don't know what it was, but I'm almost 30 now. And I was like, if I'm ever going to do it, like I want to do it now.
Right.
Well, I'm still young and I can enjoy this, I think, the most,
Mm-hmm.
rather than waiting till I'm 40 and other things start falling apart.
Yeah. Or it gets harder. Like your commitments in life get more complicated, or work or whatever, and it just gets harder and harder to
Totally
take some time off to get stuff done.
Yeah. So, and luckily, thanks to my relationship that I started with you, I think 4 or 5 years ago.
Yeah.
I felt confident and comfortable to come to you.
Right. And what did we do 4 or 5 years ago, if you don't mind sharing?
It was just, it was Botox.
Right.
I think my friends had told me about preventative Botox, meaning like if you get Botox in your forehead before you get wrinkles, then you won't get wrinkles. And so I would do it for fun with my friends sometimes. And I did it for like, I just kind of pumped the brakes on it a little while ago because I was like, I think men look kind of good with some natural wrinkles.
I agree.
But yeah, so that's why I met you.
You bring a good point up. Like a lot of men worry about Botox because they don't want to look feminine or things like
Sure.
that. And I think the key is to kind of soften the wrinkles, right? Because I think certain amount of
Right.
wrinkles look okay, but or you can get rid of them completely. But I think softening was good because like I'll get Botox, but I'll wait like 6 to 8 months
Sure.
between doing it, and I
Sure.
get definitely getting some movement back, and then starting to
Totally.
get the traces of a wrinkle. But it's good to kind of do that Botox before it gets too deep.
Right. Yeah, absolutely. And I think too, like the whole thing with men and Botox too, I think a lot more people would do it if it was more socially acceptable or
Yeah,
talked about. I think one of the scariest things is for men to admit that they might want it or would
yeah,
feel more confident if they had it,
right,
or to make the appointment to go get it,
yeah,
or to like walk in and out of the plastic surgeon's office,
right.
like without feeling self-conscious.
Did you ever feel weird walking into my office?
I mean, even I did, yeah. And that was like, yeah, even when I came with, yeah, there's a lot more women. I came with one of my good friends. It was just still like, oh, like what will people think of me walking out?
Yeah,
I don't know, some young guy. And of course, it's like all in my head. They probably, who knows? They're
right.
not even thinking about me.
Right. They could be there just, drop to like Postmates or something. Could
Yeah,
not even a
exactly,
patient, who knows?
exactly.
Well, that's really good feedback because, when I was actually, when I was in college, I had a procedure done for male gynecomastia. So
Okay.
yeah, so I had like actual kind of glandular breast growth,
Yeah.
and that was like really intimidating to me to like just to even just bring up the subject with like my parents. I was like, look, this isn't right.
Yeah.
And I showed my mom. She's like, yeah, you're right. And so go to the doctors is such an awkward thing. And it wasn't even a plastic surgeon. I went to general surgeon and all that stuff.
Sure. Yeah.
So so I hear you, but it's something I don't even think of. Like I walk in my own waiting room and I was like, how would this feel for like an average male patient?
Sure. Yeah.
So, but you were really strong and you decided to do surgery. So what surgery did you have?
Yeah. So I guess it was like 6 months ago now.
Yeah.
But I had liposuction on my chest,
Mhm.
a little on my neck.
Yeah.
Which has actually been wonderful.
It's chiseled.
Yeah.
Yeah.
More so.
Every time I look at you, I'm like, I cannot believe it. It's
Yeah,
amazing.
I look like I'm like 21 again.
Yeah.
But what was great about the neck liposuction was that I think genetically from my mom's side of the family, we kind of got like double chins.
Yes.
And even if I was like in great shape, it was still there. So I'm glad we addressed that.
Yeah. Which is funny because I think I have kind of a double chin a little bit, and unless I'm like super peak like fasting, it shows.
Yeah.
And it's like that's hard, right? It's hard to do.
Yeah.
And then I noticed my daughter kind of has it a little bit too, and I'm like, oh
Sure,
crap,
sure.
did I just pass that on?
Yeah, right.
So it is genetic, I think.
I think so. I think so. Yeah. So I'm glad we took care of that. I also got like a little liposuction on my stomach and my love handles.
Yeah.
And so I don't know. I'm really, really happy I did it.
Mm-hmm.
Another reason why I felt confident and comfortable coming to you is because I think I didn't necessarily want to change how I looked. I just kind of want to like look like the best version of myself.
Yeah.
And I know that you kind of just naturally enhance, right?
Right.
So you're not like going to do something crazy or.
Right. So there's some real key points when it comes to doing liposuction on a male patient. It's not the same as a female patient, right?
Okay.
Female
Yeah.
female anatomy and desired shapes. I mean, of course, everyone's different, but it's generally more of like an hourglass shape. For
Right.
men, it's different. We want to kind of sculpt the body in a way that's kind of like a V shape. It's kind of a
Sure.
muscular or more masculine type of form. And so that's exactly, after our consultation, that's exactly what we did for you. The neck was pretty straightforward. I did kind of try to do some things to highlight your strong jaw, which is awesome. It turned out great. But when it came to the abdomen, I do a high definition liposuction, meaning that we kind of do a little bit extra where grooves should be,
Sure.
so that you can kind of see some of the underlying muscles that you have there.
Yeah, yeah.
But the thing that is really important is liposuction is really it's not a weight loss thing. It's not like you're overweight. It's for getting rid of stubborn areas. And these are all stubborn areas for you. And the male chest area is one of the most common areas. That's really frustrating. So in summary for your operation, we took off 1,100 cc's from your abdomen, fat, 900 from the right flank, 950 from the left flank. That's like the love handles on the sides.
Sure.
And that went all the way back.
Yeah.
Right?
Okay.
Chest 375 on the right, 300 on the left, the neck 150 cc's.
Okay.
For a grand total of 3,775 cc's. Yeah. I mean, if you want to put that, like I took pictures of the fat that we took off.
Yeah.
I wish I had it here today. I'd show it to you, but did you ever see that fat?
I think I did when I was coming out of anesthesia a little bit.
Okay. Oh, gross. All right. Sorry. But if you were to put this on a table right now, that would be like two liters. Like,
holy
I know.
Yeah. Wow.
Right? You can say shit. It's a
Okay.
podcast. Yeah, that's like 2 liter Coke and 2 liter Coke off of your body. You know,
That's
and
incredible.
yeah.
Yeah.
And so it's just a really powerful way. And you know, there's other ways to do certain things like cool sculpting and
Sure.
Venus Legacy, but nothing comes close.
No,
to
because
what
I've even tried some of the
you did.
freezing the fat off
You
prior
did.
to coming to you.
Oh,
Yeah,
tell me
I think
about
I
that.
forgot about that. I think I did that because it was like the next step without going to surgery that I
Yeah.
thought before trying surgery.
Okay.
I did it on my abdomen. It worked like kind of a little bit. It was like I think a third of the price
Okay.
of the liposuction.
But one treatment, or did you get a series?
I think I got like 3 treatments,
You
but
did?
it was
Okay.
pretty much I think it was I wouldn't do it again.
Okay. Was it painful?
No.
Okay.
I mean, I felt like little bits of pain sometimes
Mhm.
when they're doing it, but no.
Okay. Well, I think that was why yours was kind of tough. I remember now because when you do get cool sculpting, it creates a lot of scar tissue.
Oh.
So yeah, it sequesters the fat. So the fat's like very stubborn to get
okay.
out.
Yeah. Okay.
So
that
I
makes
think
sense.
I remember being
interesting.
sore after your procedure. That's probably why all the cool sculpting.
There you go.
No, just kidding. No, but it's good. You know, those things have a place for everything. But I just love getting dramatic results. And
Yeah,
so,
yeah, of course.
I really feel that liposuction is body contouring is really the most powerful way to do that.
Sure.
So tell me about the procedure. You know, we did all of this removal, like when you woke up, or when you came in for the day of surgery. What were you thinking?
Yeah, so I think I was most intimidated by the idea of anesthesia. I know
Okay.
it's so funny too because anesthesia it's like very, very safe.
It's extremely safe. You're more likely to get struck by lightning. Than,
Right, or hit by or crash at a plane or something
Exactly.
crazy.
Yeah.
But I think it was just the idea of being knocked out unconscious and then having people work on you that was like just kind of freaks me out a little
Right.
bit.
You have to trust. Like it's
Yeah,
totally
you
trusted.
really have to trust.
Yeah.
And so I think that's another reason why, luckily, I knew you and had the relationship developed with you.
Right.
That I totally trusted you.
Okay.
So I was really excited. I was like ready for it.
Okay. Yeah, I mean, it is what it is, and as long as you have that trust and you've done your research and you develop that bond, you know, I think that's key, and I take that very seriously because it's just like you're out, you're completely trusting me to do this work, and
totally,
and I get really amped every day, every surgery day. I do get amped on my post-op days and my clinic days, but where I really get amped up is for surgery days, because this is where I get to really make a difference.
Absolutely, that's so cool.
All right, waking up.
Waking up was okay. Everything was okay. I think I hadn't anticipated how painful like the first couple days right after were gonna be.
Yeah. Where was it more sore?
So I think I had like a lot of swelling around my love handle area or my flank area. And it was pretty it was swollen. And then we also drove down home to Orange County, so I was like sitting in the car. That didn't help. But yeah, it was really just like the first day or so that was pretty uncomfortable.
Okay.
And then I don't know. I feel like you kind of bounced back pretty quickly. At least I did.
So tell us about the recovery. Like it was a couple of days of soreness, and then when would you say you're kind of like back in action?
Like feeling like myself?
Yeah.
Probably like a month.
Really?
Yeah.
Okay.
Yeah. I started out by doing like small walks and then gradually increasing.
Yeah.
Yeah, it's pretty funny because even now, so I feel like it's still kind of like the swelling is going down or continuing to go down.
Right.
But yeah, the wearing the body suits was kind of funny.
Yes.
Getting used to that.
Yep. Did anybody say anything?
No one said anything. No one noticed anything. Yeah, it was fairly easy, to be honest.
Good.
Yeah.
That's really good feedback. It's interesting. You know, liposuction. Yes, we get the fat out right away, but that healing response where you get that skin tightening, you get that other tightening effect, that lasts up to 6 months typically.
Yeah.
And sometimes the sensation can be a little bit off, get a little bit of numbness, temporary numbness.
I had some numbness.
Did it get better?
I thought it was kind of fun.
Yeah.
Yeah, it was totally fine. I feel everything normally.
Okay. You just got to be careful. Like if it's on the stomach and you're leaning over a hot stove, you know, like, so you could get burned. I had somebody get burned that way one time.
Oh, no.
I know. You just have to have awareness of where your body parts are. Okay. And what was the most surprising thing like that you felt occurred during that whole consult, surgery, and recovery process?
The most profound thing?
Profound or surprising? Yeah.
I don't know. So I think the best part of the whole process was working with you and your team.
Okay.
You guys were incredibly made me just feel really, really comfortable.
Good.
From you to the nurses to the front of the house or I guess that's what we call it in restaurants, but
the front of the house,
the front of the house, the
front office.
Everyone's fantastic. Really makes you feel really comfortable.
Okay.
Yeah, I think what was most surprising is in my head I had like an idea, like I thought liposuction was so dramatic and like
Yeah.
so intense, it's so crazy, like surgery. But you know,
Right.
it's not quite as intense as I'd imagined. And I don't know, I'm really happy I did it.
Okay.
Yeah.
How are clothes fitting?
Great.
Yeah.
Great. Yeah, I think the biggest thing that I noticed is like when I put a t-shirt on, I would always like look at my chest and kind of protrude a little bit more in like
Right.
not ways that I wanted it to, but
Mm-hmm.
now it's like kind of flat and even. And
Mm-hmm.
I don't know, I just feel now it's really nice because I throw clothes on. I don't think about it anymore when I'm
Yeah.
walking down the street, or like I'm not like in my head self-conscious about it. I think that's
Yeah.
probably like the best side effect of all this stuff is that I just feel more confident and
Yeah.
comfortable in my own skin, which is really cool.
That's amazing.
Yeah.
I mean, I really can't like that makes my day because it's just I made it like that's gonna be with you for the rest of your life.
Right. And
Yeah.
like I said before, I'd like literally been in my head, it's like self-conscious about this stuff for probably
Right.
like 20 years.
Yeah. And it's so tough because it's like people we live in like, oh, be confident in your body. And,
Yeah.
you know,
Oh,
and it's like,
man.
I believe in that. Do that as best you can. Right.
Yeah.
Don't obsess over little things. But if it's really getting to you and you've thought about it for several years and there's a plastic surgery fix for it,
Totally.
do it.
Totally. I'm all for it.
Yeah, just do it. Life's short.
Yeah, life's
You know,
short. Yeah.
it's just like enjoy it and go get the body you want as long as it's doable and
And it's
reasonable.
healthy. And
Yeah,
I completely agree.
yeah. Well, that's fantastic. And um, in terms of, I meant to ask you more about your results, like waist size measurements. Like, are you same size in waist or
Yeah, actually, I think the waist has shrunk a little bit.
has a bit? Okay.
Yeah, I think I haven't like using tape measures or anything like that. I've kind
Okay.
of just been going off of how I feel and
Yeah.
just trying to, because I want to have like a sustainable, healthy, like, I don't know, way to approach things moving forward or continue
Yep.
to move forward. But yeah, I feel great. I think what's most important too is like I've been paying attention to how I feel in clothes and like how I look when I look in the mirror.
Okay.
Like, I remember when I like caught my image in the mirror at first, I was like, holy shit, like I look
Yeah.
like that now. Cool.
Yeah.
Like, that's amazing.
That's awesome. I just burn that mentally in my brain, you know, because that's so cool. Because it's just very rarely do you have something that happens to you in life that makes like a positive impact on your appearance.
Totally. So I don't know. I'm a patient for life. I love you guys.
Ah, thanks, Travis.
Yeah.
Appreciate that. Well, you know, so men in plastic surgery, you know, this is LA. It's actually it's more common here than any other city,
Sure.
which is fantastic. But it's still on the smaller side. What
Yeah.
what would you tell like a male out there, a man out there that's thinking about doing something that bothers him?
Yeah, I think it's a really great question. I think most people, I mean, I think we all want to feel great and we all want to feel like the best versions of ourselves and we all want to feel good.
Mhm.
And I think men kind of play that down a little bit more to like act more masculine.
Mhm.
So I would just say like listen to your gut, trust yourself, and if it's something that you want to explore, like do it, and who cares what anyone else thinks, as long as you feel good about it and as long as you're doing it in a healthy manner.
Right.
I think that's what I think is the most important.
Yeah. And I think if you are considering getting a plastic surgery procedure, get someone who has male patients, who's familiar with the male, the differences, the subtle, nice but important differences for doing male body contouring and so forth. A board certified plastic surgeon, you definitely want to make sure that they're legit, and those are really key things.
Yeah, I mean, I know that actually reminds me of something too. When I met you 4 or 5 years ago, it was through a referral. My friend Kareem. Yeah, which I was like, great, cool.
He was actually working here.
Yeah, he was working here. Yeah. And so you always trust it more when it's referral. But then I went to do my own research and I looked online and I saw your Yelp reviews and I was like, okay, great, because that's the other thing that I really use too. So it's like I feel like you can really trust.
Yelp is actually pretty legit because you can't take any of those reviews down.
Yeah,
and they tend to keep everything up there. So it's like you get the good and you get the bad. And and which I think is good. I think everybody benefits when you can. Of course, you can have some made up ones, right? Where people just make stuff up about you.
Sure.
But I think by and large, most people know how to filter those out, right? And
so of course. I mean, everyone's gonna you're gonna get like a little bit of this and.
But you can. I think it keeps. It's like your Uber, right? When you get an Uber, you know you're getting judged. Versus you get in taxi, it's like that guy knows he could talk on the phone, and you have no way to directly rate him. Yeah, totally. And when was the last time you were in a taxi?
I don't even remember.
Right? You know what's funny is certain cities have banned banned Ubers. Where was it? I think it was Vancouver. I can't remember. But I thought that was so sad because there's no way to kind of review it.
Sure.
But anyway, we have a third special guest here. Is this June? This is so cute. Can I hold? Is it him or her?
It's a girl.
Yeah. June, come here.
She just interrupted her nap.
Oh, sleepy girl.
Oh my Okay.
Hi, baby.
So we have June. And how old is June?
June is only 3 months.
Oh my goodness.
As you can tell, she's getting some wrinkles. I'm just
Yes.
kidding.
So we have some doggy Botox ready for you.
Yeah.
And then is this your first dog?
First dog that I've had for myself
Yeah.
as an adult. Yeah.
Yeah. And then how did you make a decision to get June?
It's kind of funny. I took some like dog like selector tests based on my lifestyle and all that kind of stuff.
There's dog selector tests.
Yeah, well, it tells you like what your lifestyle's like and what's the best fit. And so I kept coming up with French Bulldog because they're like great for apartments.
Oh, it's a Frenchie.
Yeah.
Wow.
She's like a Oreo cookie Merle.
Wow. Oreo cookie Merle. This is like I feel like this is a designer
Yeah.
spots here. You guys, you got to check out. If you're listening to the audio podcast, you've got to check out the video version of this.
She's the cutest.
Here, let me hand her over to you.
Hi, baby.
She misses you. That's so special. Well, I didn't know that, but that's so cool.
Yeah.
So now you got a cute puppy.
Got a cute puppy.
You got an awesome body.
Looking good.
There's nothing holding you
life.
back. Yeah.
Life is good.
Yeah, life is really good, man.
Yeah.
So I'm so happy for you. I'm excited. We should we'll do another like follow up, and I will get some your final measurements and see because I think we recorded your waist measurements prior, and I know that's definitely probably changed since the surgery. But can we hand the dog off to one of you guys really quick?
Yeah, let's do that.
Okay.
That is an awesome puppy.
Yeah, she's
That
a
is
cutie.
oh my god.
We'll need her for your picture.
Okay.
All right. All right. So Travis, so I've got your notes here. Your previous waist measurement was 41.25 inches. Would you be willing to let me do a waist measurement?
Yeah,
on you?
sure.
All right, here, let's come
Yeah.
stand up and we'll do it. I'll do it from right here. And I'll stay with the mic here so that they can hear us. And let's go ahead and just pull this up just a little bit. All right. So we're doing the waist measurement. Okay, guys. And I'm gonna get this all the way around. Right at the belly button. Wow. You are 38 inches.
So that's what, like 3-4 inches?
That's 3 inches.
Sweet.
Over 3 inches
Great.
of improvement.
That's awesome.
High five.
We love that.
What a difference. I mean, you've
Yeah.
kept the same activity and everything else, and we've just took off 3 inches off your waist.
Yeah, it's amazing.
Yeah, and we haven't even touched all the other measurements, but when we do your 6 month, we'll record all that. We'll put that in the show notes and everything, so we can and we'll share it with you, obviously, in your digital before and afters and everything.
Perfect.
So awesome. Well, Travis, thank you so much for being on the show.
Thank you.
Is there anything else you want to share with those people out there? Any particular listeners?
I guess not really. I mean, if you're interested, I think explore it. It's totally worth exploring. I think it's can have really positive effects on your life if you decide to go through with it. Yeah, Dr. Barrett's a great guy. I highly recommend him. So,
Travis, you're amazing, and keep in touch. And we always enjoy having you in the office.
Cool. Thank you so much.
All right. Thank you.